Hello and welcome to another quick series video where we cover the DSM-5 as well as relevant clinical, diagnostic, and test-based scenarios. In this video we cover excoriation disorder. If you haven't heard of that before, it is commonly known as skin picking disorder. I think a very good way to memorize this is to think eczema. And many people already know eczema is a skin disorder, so it's actually not that hard to memorize if you can remember that. Okay, so looking at the DSM-5 criteria, you'll see the first thing is that it does have that persistent skin picking. The important thing to note is that it must lead to some lesions, okay? So damage to the skin. You cannot have this disorder if there is no damage. So if you were given a scenario, for instance, where someone presents with either scratching of the skin or skin picking, or really any skin-based somatic fascination, right? You're going to want to think hard, okay, are there actually skin lesions here? And if there aren't, you might want to not make this diagnosis. Importantly, there needs to be multiple attempts of the person trying to quit. Just to reiterate, the patient must have tried to quit at some point, at least more than once. We also want to see distress, and this could look different for different people. For some, this may be a complete loss of control, and they may find that distressing. There may be embarrassment. They may feel shame at the scars on them, and there may be an attempt to cover this up, okay? However, this doesn't have to be the case. This could be occupational distress, so someone could need to do this privately, and that's keeping them from doing social activities, or going to work, or performing well in school. So distress doesn't necessarily just have to mean overt, blunt distress. It can mean some form of a deficit. And we also want to make sure that whatever has been causing these symptoms is not because of some other disorder or the use of a foreign substance, okay? Now, before we jump into what could create that scenario where you perhaps think it's excoriation and it's not, let's look at the onset. So typically this is going to start at adolescence. It is going to be at the onset of a dermatological condition, commonly acne. But this does not have to just start at that time period by any means. This can start technically at any age, and when it is not treated, it is commonly chronic. Another thing that may bring on the onset of excoriation is already having OCD. If you have OCD, you are more likely to have excoriation. But you need to make sure that it's not actually OCD that is causing these symptoms. How could this happen? Well, think about a scenario where someone is washing their hands a lot. I go into this in another video where we talk about OCD. However, if you have OCD and your compulsion is to wash your hands, you could continuously wash your hands until you have skin abrasions. But this doesn't mean that you have excoriation because you would actually have OCD and that would be causing the damage to your skin. Interestingly, you also want to look for something called dermatitis artifacta, and that also is referred to as factitious dermatitis. If you can guess from the name, just like factitious disorder, right, or malingering, people may cause damage to their skin for their own benefit, right? If they find joy in people taking pity on their skin condition, they may actually damage their skin to evoke that reaction. So just because they're intentionally damaging skin does not mean that it is always going to be excoriation. Now, similar to trichotillomania, you also want to look out for neurodevelopmental disorders. So, for example, stereotypic movement disorder, autism spectrum disorder. You want to make sure that people with this and that present with skin lesions, that this isn't a secondary outcome to their primary disorder. And just for a quick example, if someone has a neurodevelopmental disorder and is exhibiting stereotypic movements that in the process damages their skin, you would not want to diagnose them with excoriation because this would be a secondary outcome to their primary disorder. Now, another thing you want to look out for is if this is non-suicidal self-injury. If this is non-suicidal self-injury, this will not meet the criteria for excoriation. And I think a good way to describe this is predominantly based off of what motivates someone to harm their skin. To not go into too many details, for someone who has excoriation, it's going to be more like OCD, where there is a feeling of emptiness followed by a feeling of completeness. And this isn't the case for everyone, but it is for the predominant amount of cases that the reason they are doing this is to fulfill some form of a compulsion based off of an obsession, right? And that's how it's similar to OCD. Okay, another thing to look out for is this related to substance use? If someone is taking cocaine or say bath salts and in the process of taking these drugs, they are damaging their skin, this would not qualify them for excoriation even if this is chronic. One thing to remember with excoriation, and probably the highest yield, is that people with excoriation also have trichotillomania in a lot of cases, right? So there's this almost somatic sensory fascination that seems to be congruent among people suffering from these disorders. Another thing to look out for is obsessive compulsive disorder, because once again, people with obsessive compulsive disorder are much more likely to suffer from both trichotillomania and excoriation. And let's also note that women are more likely to have a comorbid major depressive disorder diagnosis with excoriation. Okay, so let's go into the medical management that someone with excoriation may be likely to receive. So, SSRIs, specifically fluoxetine, in one recent meta-analysis has been shown to be efficient in the medical management of excoriation. Additionally, cognitive behavioral therapy has seen significant results. Okay, so that wraps up our video on excoriation. If you found it helpful, please consider liking and subscribing for more content just like this. If you're interested in any of the psychopathologies we covered today, please consider checking the playlist listed right here to see if we may have covered it already.